If you're experiencing symptoms like pain, burning, and the feeling of needing to urinate urgently or often due to irritation of the urinary tract, Uristat Ultra 99.5 mg Tablet Urinary Analgesics can help relieve these discomforts. It doesn't treat the cause of the irritation, but it can provide relief while other treatments take effect. The active ingredient, phenazopyridine, acts as a painkiller to soothe the lining of the urinary tract. It is recommended to take this medication with a full glass of water and with food to help prevent an upset stomach. It is important to follow the dosage instructions provided by your healthcare professional. Always consult with your doctor before starting this medication to ensure it is the right choice for you. When taking Uristat Ultra 99.5 mg Tablet Urinary Analgesics, it is recommended to take it after meals, usually 3 times a day, or as directed by your doctor. If you are also taking antibiotics for symptoms related to a urinary tract infection, or are self-treating, make sure to not take it for more than 2 days without consulting your doctor. The dosage will depend on your medical condition and how you respond to the treatment. If your condition persists or worsens, be sure to inform your doctor. If you experience headache, dizziness, or stomach upset while taking Uristat Ultra 99.5 mg tablet, it's important to notify your doctor or pharmacist. However, many people using this medication do not experience serious side effects. It's important to tell your doctor right away if you experience any serious side effects such as yellowing skin/eyes, dark urine, signs of kidney problems, stomach/abdominal pain, vomiting, fever, chills, easy bruising/bleeding, unusual tiredness, shortness of breath, fast heartbeat, or seizures. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed above, it's important to contact your doctor or pharmacist. Before you start using Uristat Ultra 99.5 mg tablet, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that could cause an allergic reaction. It's also important to discuss your medical history, especially if you have kidney disease, liver disease, or certain blood disorders. This medication may cause dizziness, so it's important to avoid alcohol or marijuana while taking it. Be cautious when driving or using machinery until you know how this medication affects you. It's also important to discuss any use of marijuana with your doctor. If you have surgery scheduled, make sure to inform your doctor or dentist about all the medications you are currently taking, including prescription drugs, non-prescription drugs, and herbal products. One thing to be aware of is that this medication can turn your urine and tears orange-red, which may stain clothing and contact lenses. It's best not to wear contact lenses while using this medication, and your urine and tears will return to their normal color once you stop taking the medication. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication. It's important to be aware of potential drug interactions when taking Uristat Ultra 99.5 mg Tablet Urinary Analgesics. This medication may interfere with certain lab tests, so it's crucial to inform your doctor and lab personnel about your use of this drug. Additionally, it's important to keep a list of all the products you use and share it with your healthcare providers to ensure the safe and effective use of this medication. Always consult your doctor before making any changes to your medication dosage or starting or stopping any other medicines. If you or someone you know has taken too much Uristat Ultra 99.5 mg tablet and are experiencing serious symptoms like passing out or trouble breathing, it's important to seek immediate medical help. You can call 911 or reach out to a poison control center right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. For those in Canada, you can call a provincial poison control center. Symptoms of an overdose may include unusual tiredness, changes in skin color, changes in urine output, shortness of breath, rapid heartbeat, yellowing of the skin or eyes, easy bleeding or bruising, or seizures. Remember, it's crucial to seek help if you or someone you know is experiencing any of these symptoms after taking Uristat Ultra 99.5 mg tablet. It is important not to share this medication with others. This medication has been prescribed specifically for your current condition, and it should not be taken later for another pain-related condition of the urinary tract unless instructed by your doctor. In such cases, a different medication may be necessary. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take the next dose at your regular time. Don't take double the dose to make up for the missed one. Make sure to store Uristat Ultra 99.5 mg tablet urinary analgesics at room temperature, away from light and moisture. It's important to keep it out of the bathroom and out of reach of children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless you're specifically told to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.